working with clients who, especially when they've been through trauma, they don't trust anybody. So even if you are really good, like I was, I've been a therapist for over 20 years, and I was really good at reflective listening. So my clients felt like I understood them, but they were still suspicious if they've been through a lot of trauma, because what people have learned is that people might be nice to me, but they'll betray me later or they'll abuse me later. So even if you feel like, I'm doing the best I can here, I don't know why this client's still guarded with me, are they resistant? What I found is that we have to learn and appreciate that they're not going to trust people, and that's why we have to be really genuine with them. And what I talk about in the book, Rethinking Trauma Treatment, is I've figured out if you look at their attachment style, that's going to tell you how they're going to respond to you and how you can meet them in a way that they're going to trust more. For example, an avoidant client, they don't like touchy-feely stuff. They're very no-nonsense kind of people. So if you start more with education with them, they like humor, help them understand what's going on with their brain, help them understand, I know this guided imagery might seem hokey, but I'm doing this because your emotional brain thinks in pictures, not words. If you can bear with me for a moment, they're more likely to trust you and go along. People with an anxious attachment style like the touchy-feely. What they want to feel is nurtured and comforted and encouraged and validated. So all of that stuff we learned in graduate school works with them, but you can get stuck with them because they sometimes just want to use the therapy session to complain all the time. And it's very hard to begin to challenge them or to move them towards doing something different because they're very sensitive to criticism, and they'll automatically get defensive and think that you're telling them your problems are all your fault. So this book, I go through all of that because I found, why didn't we learn this in graduate school? How you have to kind of adapt for different clients, why it's going to take longer with some clients to build trust than others, and how you can gently get them to trust you in a way that makes sense for their trauma history. You have to keep in mind that for some people, it could take months. Like with people with disorganized attachment, they've often been abused by the people that were supposed to take care of them. So that it could be a year before they actually trust you. And I want therapists to feel more confident in what they're doing, and I want them to feel like they can be more genuine and authentic, because that's really what people who've been through trauma are looking for. They don't care how smart you are or how many books you've read. They want to know, like, can you really relate to my pain?